Today, we are covering pneumonia, a topic the NCLEX loves to test through priority and delegation questions. The exam will expect you to differentiate between the types of pneumonia. Community-acquired pneumonia is contracted outside of a healthcare facility. In contrast, hospital-acquired pneumonia, or HAP, develops 48 hours or more after hospital admission. This 48-hour rule is a classic exam trap. If a patient is admitted for surgery and spikes a fever with a productive cough 24 hours later, it is not HAP. It's crucial to identify the source to guide treatment. A third type, aspiration pneumonia, is common in patients with swallowing difficulties, such as post-stroke or those with a decreased level of consciousness. An exam question might describe a patient with dysphagia, and your role is to identify the risk and implement aspiration precautions immediately. When assessing a patient, look for the classic signs like fever, chills, a productive cough with purulent or rust-colored sputum, and pleuritic chest pain. However, the NCLEX will often test you on atypical presentations, especially in older adults. A common trick is to present an elderly patient whose only initial symptom is new-onset confusion or altered mental status. This is a priority finding that indicates hypoxia and must be addressed immediately. Diagnostic confirmation comes from a chest X-ray showing infiltrates and a sputum culture to identify the organism. Remember this critical exam point. Always try to obtain the sputum culture for analysis before administering the first dose of antibiotics. This ensures the culture's accuracy. Nursing interventions are all about the ABCs, focusing on improving gas exchange. If a question asks for your first action for a patient with dropping oxygen saturation, your answer should be a direct intervention to improve breathing. This usually means raising the head of the bed to a high Fowler's position to maximize lung expansion. Other key interventions include administering prescribed oxygen, encouraging the use of an incentive spirometer at least 10 times an hour while awake, and promoting adequate fluid intake to help thin respiratory secretions, making them easier to clear. You will also need to monitor for signs of deterioration, such as worsening respiratory distress or signs of sepsis like hypotension and tachycardia. To help remember these key nursing actions for the exam, use the mnemonic BREATHE. B stands for bed head elevated. R is for respiratory assessment, including vitals and oxygen saturation. E is for encourage fluids and nutrition. A stands for antibiotics, remembering to get cultures first. T is for turn, cough, and deep breathe. H is for high-calorie meals to support recovery. And finally, E is for evaluate for deterioration. Focusing on these priorities will help you navigate complex pneumonia questions on the NCLEX and select the correct nursing actions to ensure patient safety and effective care.